Very important blood tests to get. Whether you are going through the system and your own doctor, or you are ordering your own blood tests and going outside of the system, as lots of people are also doing nowadays, we want to go over the most important blood tests to get to determine your baseline metabolic health. What the different blood tests mean, we're going to go over them one by one, and we will list them all as well in the description down below. And for anybody who enjoys our discussions, please do also check out our separate, unique channel. Links down below in the description. And we post exclusive content on our other channel as well, all relating to matters of your health and well-being and what you should know. Okay, let's dive in then right now. If you're getting a blood test with your doctor or ordering it yourself, and we will go over later if you wanted to order it yourself, how to go about doing that. But let's talk first about this crucial blood test, complete blood count, also known as CBC. Ben, would you like to elaborate on that?
I sure would. So the complete blood count is, as Suneel said, a very important test. It has three major components. It has the white blood cells, the red blood cells, and the platelets. Now, the white blood cells are the cells that fight infection, and if they're too high or too low, they could spell a problem. Now, that would be the first indicator that there might be a problem, and then it breaks down the types of cells that there are, which can give you even more information. So that can be a nice trigger to us that something might be going wrong. The next thing is your red blood cells. Now, that actually is best shown by two other things that are on the labs called your hemoglobin and your hematocrit. You may have heard of those terms because if they're low, it's called anemia. There's a lot of different kinds of anemia. There's iron deficiency anemia, but it depends on many things. One of them is how fat the red blood cells are. If they're very tiny or if they're very fat, it can be very different diseases. For example, if they're very fat, and that would be shown on this panel, it could be a B12 or a folate deficiency, so vitamins could play a role in that. And the last one is the platelets. Now, those help you clot and make sure you don't bleed easily. So those are very important to watch as well. And if they're ticking down, you need to know why. So that can tell you right away, looking at those, if you have one of those kind of problems. And there are many, many more problems it could tell you about as well.
It's so true. That's such a great breakdown, Ben. So I always tell my patients, and just break it down even a step further, and I'm going to focus on anemia here because I think that's probably what we're always checking for when we check a CBC is with anemia, which is, low red blood count. And it's really two ways of developing anemia. One is you're losing it or you're not producing it. All right. So losing it would be you're bleeding somewhere, not producing it, it's a bone marrow issue, or maybe you're missing something like iron, B12, or, some of the other things we talked about, Ben. But in the cardiology world, anemia is super important because it's really the great mimicker, right? And so people can have such non-specific findings or symptoms, I should say, of shortness of breath, fatigue, just lethargy, just lack of ability to do things, drop in exercise tolerance. And that can really exacerbate a lot of things in the cardiac world and the heart world that I'm in. And specifically can get people worse chest pain, especially if they have coronary artery disease. People have AFib. If they have low blood counts, that can exacerbate and precipitate episodes of AFib. And congestive heart failure, we know that anemia is a precipitator of all those things above.
Yeah, that's very important. So complete blood count, often the first test that is ordered, you've probably heard of that, CBC, also known as FBC in the United Kingdom. And that most commonly will diagnose anemia, which is low hemoglobin and hematocrit. And we'll also look at your platelet count. If that's low, that could indicate that you have a clotting issue. Conversely, it could be high. And as Ben brilliantly mentioned, white cell count is the other component we look at. Also the size of the blood cells called the MCV. So that's the first one that we would like you to know about. The second blood test to get is the complete metabolic panel, also known as CMP. So this will look at your kidney function and your liver function, one of the most common tests that we order. Peter, would you like to elaborate on that one?
Yeah, so that panel is really important as well. I think all these panels we're going to talk are important. It really angles around your kidneys and your liver function. And so really it's looking into your sodium, potassium, and basically your electrolytes. And, we know that low electrolytes can cause a lot of different things like muscle cramping, arrhythmias in the heart world. The other important part of it is your BUN and creatinine, which is a measure of your kidney function and filtration effect of your kidneys. And the other important thing is that we always worry about is our liver function test as well.
Yeah, so it completely agree. That panel can tell you a huge amount about your metabolic health. Now, another important thing with the liver and kidneys is, are you on the right medications? Are you on the right doses? Because if you're on medications right now, odds are they're filtered by either the kidney or the liver. So it's an important thing to know, very regularly if your kidney function is going up or your liver function is going up, do your medications need to be adjusted, or are your medications causing that? A lot of medications we know hurt the liver and hurt the kidneys. So you need to know, are my kidneys and are my liver doing okay? The electrolytes is extremely important. Low sodium, called hyponatremia, can be a significant problem that causes you to get hospitalized. It's good to catch it early. And if you are having that problem, you need to know why it's happening and need to address it. And there are multiple other important electrolytes that are seen on the complete metabolic panel, but it's really a good overview of a lot of this stuff, and it helps us dramatically in the patient.
It's also important to say that all medications that you take are either broken or excreted out of your body through the liver or the kidney. And so a dose of one medication might be appropriate for you now, but if you had suffered kidney injury or trouble with your liver, that medication might not be cleared appropriately to those organs, and those elevations can raise in your bloodstream, and that can make it dangerous too as well.
Absolutely, yeah. Complete metabolic panel, as you rightly talked about, liver function, kidney function, electrolytes, liver function tests often elevated and need further investigations. Also, your calcium and your albumin will be detected on those. I think it's fair to say that typically when doctors want a baseline on somebody's health, CBC and CMP are the two tests ordered first.
The
and then we have foundations of anybody's health. So please remember those two. And again, we're listing everything down below. The next one we want to talk about is HbA1c, glycosylated hemoglobin, which is a marker and what we use for measuring pre-diabetes or type 2 diabetes. Ben, would you like to talk a little bit more? You order HbA1c a fair amount?
Oh, sure.
Yeah.
Order it quite a bit. Very important lab. So I'll talk to you a little bit about what it is and then the cutoffs. So basically what's happening is that glucose or sugar is floating around your bloodstream because it's not being absorbed appropriately. And what it does is it attaches onto the red blood cells, and you can measure how much is attached. And actually over time, we've found the cutoffs of what signifies pre-diabetes, what signifies diabetes, and what's controlled and what's not. So anything above 5.7, we call pre-diabetic, and that gets worse as you head towards 6.5. And HbA1c of 6.5 and above is diabetic. So if you are above that, that is technically classified as diabetes. And that means there's too much sugar floating around your blood, attaching onto your red blood cells. And if it's attaching onto your red blood cells, it's attaching onto other things too and causing damage.
Exactly, yeah. And HbA1c is a measure of your glucose control over 3 months as opposed to fasting glucose, which is on the CMP, which is a spot sort of check of glucose. Do you use HbA1c a lot, Peter?
Yeah, it's such an important metabolic factor. And really, why are we checking all this blood work? Because we all want to live longer. So in a sense, you can attach longevity to HbA1c. So, people who have high HbA1cs have high insulin resistance, high hyperglycemia, high glucose in their bloodstream, diabetes, and left uncontrolled, people don't live as long. They have increased risk of stroke, heart disease. There's a whole multitude of syndrome and diseases. So it's really important, and actually in all aspects, I think, of medicine, specifically, in general medicine, but also in cardiology.
Yeah, HbA1c, really important. So that's third on our list. The next one is fasting insulin. And I'll lead on this, gentleman, because I'm probably the biggest fan of fasting insulin as a doctor who practices metabolic health. But I do not, for the life of me, understand how the medical establishment does not order fasting insulin. In fact, you go to a lot of doctors nowadays, and I've had this feedback from people who've watched my videos, and they'll kind of look at the patient sort of cross-eyed, not knowing what on earth a fasting insulin is. And I think this is all going to change because currently the medical profession kind of will take directives and only know what's taught to them. But actually a fasting insulin test is absolutely crucial, in my opinion, for metabolic health. And most of the people that I've communicated with have ended up having to go out of the system to get this done. So let me explain the reason why this is important. Fasting insulin starts going up years before HbA1c. So I have seen many, many people who have normal HbA1c, and I've checked their fasting insulin level and it's sky high. So the reason why this is so important is that insulin resistance, which is an absolute pandemic of epic proportions right now, precedes the diagnosis of pre-diabetes, at least according to the medical establishment, by 10 to 20 years. And it can be picked up, and if anybody is so inclined, they can make lifestyle changes to lower this, because it will dramatically increase your chances of getting sick, of eventually getting diabetes and other inflammation. And the medical establishment, as far as I'm concerned, is completely uneducated on this test. So once a fasting insulin is checked at the same time as a fasting glucose, you can calculate something called HOMA-IR, HOMA-IR. This number should be as close to 1 as possible. As it gets up towards 2, it indicates insulin resistance. And as it gets up towards 3, 4, 5, it's usually full-blown diabetes. So this is a test which I encourage a lot. And I do want to touch upon, for a moment, people who decide to go outside of the system. Now, of course, it's always advisable to work with a medical professional, but I know there's many people, I've been contacted from people overseas, by people from overseas who don't have timely access to care. And there are plenty of labs where you can basically order tests online. I know there's many in the UK. In the United States, we have labs like Quest, for instance. By the way, I have no relationship with Quest, but I have used them before myself, because personally, I don't go through the system. I do my own tests, but I accept that I'm privileged as a doctor and I have that know-how. But typically, when tests are done, they will be flagged as abnormal. So then you can go and talk to your doctor, and many people are paying out of pocket and getting their own tests done. So I wanted to add a word about that. If you can't get fasting insulin and that is an option for you, then consider it, and you can Google in your area and find somewhere that can measure it if your doctor can't order it, doesn't know about it, or you just want to take the initiative yourself. So that's fasting insulin level. Crucial in my opinion. Next up, let's talk about vitamin D levels, which again are an absolute pillar of your metabolic health. Ben, I'm sure you're big on vitamin D.
Oh, yeah. So we order vitamin D levels very regularly. So you can get vitamin D through your diet. You get it through the sun, and it converts basically cholesterol into vitamin D on your skin. And then you can get it through supplementation. Now, it's important because low vitamin D can affect you in a number of ways. The most famous way is, your bone health. But it can also affect you in many other different ways. And we've been finding more and more it can affect people's kind of mood, fatigue, things like that. And I have experienced increasing vitamin D can help with a lot of those conditions.
Okay, everyone, I'm going to interrupt that tremendous discussion for a moment to tell you about our expanding health and well-being store. I'm very proud of our natural, uniquely formulated products. Check in the links down below. We've got our natural anti-inflammation immune support, bone support, memory support, heart support, and sleep support. Also, our newly released organic chai mix based on the tea that I regularly drink. We are made in the USA and very proud to be working with a veteran-owned company. ohighwellness.com if you're in the USA, North America, ohighwellness.co if you're in the UK, Europe. All right, back to the discussion.
So,
yeah, exactly. Yeah, and they're finding links with immune health as well. But vitamin D is really, it's astonishing. Often I will check it in hospitalized patients, often older men and women in their 80s and 90s, and it will be in the single digits. And we want at least 30 usually, bare minimum. Often it should be much higher, but that's a bare minimum. And you can imagine how weak that will be making their bones. Have you seen any links, Peter, between vitamin D and cardiac health?
We do know that vitamin D deficiency has been linked to heart disease. I think the bigger picture too is it's, people are predisposed to fractures and depression as well. And I think obviously if people have depression or fractures, not exercising as much. And so I think it's a general picture. It fits in with all the other metabolic factors that we've talked about. And it's so important.
Yeah. So get that test done as well, whether you go through the system or outside of the system. Next up, we have iron levels, which are often astonishingly low, especially in females. Do you find that as well? Low iron?
Well, iron can be low for many different reasons, but It's interesting. So the first thing you do is check the CBC. And then, like we said, if you're anemic, we need to know why. And if the red blood cells are tiny, they're skinny and small, and the MCV is low, that was an interesting thing we talked about, could be iron. And if your iron's low, either you're not absorbing it, you're not getting enough of it, or you're bleeding. So, in women, we see it can absolutely be lower than in men. That's a more common phenomenon. And you often will need replacement. It is amazing what replacing iron in somebody that's low will do. They'll feel so much better. It's very important, and it's important for the heart too, correct?
Yeah, I mean, again, iron deficiency anemia is just such a mimicker, and it's probably iron deficiency. You can probably say it's probably one of the number one reversible causes of exhaustion or fatigue in females. And they're just prone to more iron deficiency. And so, as I said before, iron deficiency can mimic most of the heart conditions that I see: atrial fibrillation. It can worsen shortness of breath, chest pain, and people just feel fatigued. The other thing with iron is the opposite way, is people with excess iron that can affect the heart. There's some more or less, conditions that cause hemochromatosis, which is not as prevalent, but it is something really important. It's excess iron in the bloodstream that can deposit in the kidneys, the pancreas, and also the heart as well. And it's a known entity out there, and I think it's really important to check that. So
exactly. Iron levels. There you go. That's next. Okay. So we will move on now to another blood test called CRP, C-reactive protein. I find this a really good generalized marker. It's non-specific, but it's a great marker for inflammation generally in the body. For instance, when I see patients in the hospital with a severe infection or some other inflammatory disorder, the CRP will be really high. It should be in the low single digits, and often it's in the hundreds. And then as someone gets treated, say they get antibiotics for their infection, you will see the CRP come down. But there's also a link with heart disease, isn't there, Peter? CRP.
Absolutely. Heart disease is an inflammatory process, and I can't stress that enough. And so CRP is sort of like the fire alarm for your blood. So it's really checking for inflammation that's going on from just dietary causes or just other metabolic factors going on. But we do know that elevated CRP levels increase risk of heart disease, major cardiovascular events, which include stroke. And that's why cutting back on things like refined carbs and eating better, regular exercise can lower CRP levels.
Yeah, but so Ben, in the primary care setting, you probably have less use for measuring CRP generally unless you get it as a baseline.
That's true. We don't, it's not as common. We'll usually do it to trend disease states, like if you have a known inflammatory state and we're trending to see if you get better, like an infection or something like that. But we also work closely with cardiology. So sometimes we're managing that together to see if it's going down, to see if it's being treated appropriately, and other conditions as well.
Yeah, I think one point on CRP is, so if it's elevated to a point and there's not anything really going on, we can say that that's probably important in measuring cardiac inflammation or inflammation in your vasculature. Sometimes if that level is very high, like sometimes you'll check in the hospital when people have pneumonia. If it's really high, there's probably some other infection or some type of inflammatory process going on.
Yeah, that's right. Okay, CRP, folks. All right, next up, lipid panel, cholesterol. Now, I always have a lot to say on this. I'm not the biggest believer in the lipid cholesterol hypothesis, and I think we've overly focused on cholesterol numbers. Peter, I'll let you go on this because I know you've got a lot to say about lipid panel. What do we look for, and what are the important aspects of this?
Sure. I think we should just shift away from just the overall total cholesterol in a way and look at how your LDL is actually made up. So your LDL is your bad cholesterol. The lower the better. Your HDL is your good cholesterol. So it's really not about necessarily what your LDL is, but break it down into different sizes. So people can have large particle LDL, they can have small particle LDL. So think of large particle LDL as like fluffy cholesterol that can smoothly go down to your bloodstream. The smaller, dense particles of LDL are the ones that are called atherogenic, meaning that they can get into the walls of the vessels a lot easier, and they're the ones that really build up plaque. And it's, so you have basically large particle and small particle LDL, but also whether inflamed. So we talked about CRP earlier. So if you have elevated CRP and then you check your cholesterol profile And this can be done by talking to your doctor, and there are lots of different panels to break this down. So if you're high in small, dense particle LDL and you have inflammation, we can say that also that might be oxidized. So those are just inflamed LDL or bad particles that will go around. And that's why two people can have the same LDL cholesterol, and one person may have a heart attack with that. The other person may be fine and not being laid down plaque. And I always get this question all the time is, my cholesterol is this, but it's not that bad, but why do I have development of plaque in the arteries? And it really is just coming down to different particle size and as well as if it's inflamed or not. The other, just a genetic determinant, is something that people read about called lipoprotein A, which is really a genetic determinant if your particles are more atherogenic. Are they more susceptible to attaching to the walls of the heart? And that's more with genetics, and lifestyle doesn't play as much a role in that, but still it's really important for this complete picture.
Yeah. I expect that you check fasting cholesterol panels a lot in primary care.
We do check them a
Yep.
fair amount. The other thing we take the other trend I've noticed that's really kind of fascinating is the HDL itself, the good cholesterol. I have found in people that are very healthy, that have lived a very long time, often have very high HDLs.
It's so true.
Yeah.
If you look at HDL panels, I mean, we know that when people are put on cholesterol medications, they bring down LDL. They don't really necessarily boost up HDL. That's really with regular low impact exercise. And I think you can definitely correlate people with very high HDLs who are living longer. I'm sure if you go to some of these blue zones around the world and randomly drew blood, is that you would see these people with amazing high HDLs. And so it's just regular walking.
Yeah. Okay. Lipid panel. Yeah. Even though I'm not a fan of the lipid cholesterol hypothesis, I still advise checking it. And in my opinion, actually, this isn't my opinion, this is actually backed up with research. The most common reason for high LDL bad cholesterol is people who are insulin resistant. Not everybody, but most people nowadays are insulin resistant, and a process called de novo lipogenesis happens when all the carbs and sugars that people are absolutely plowing themselves with nowadays get converted into fat particles. So lipid panel is always good to get. Okay, next up, thyroid function, TFTs, commonly abbreviated. So the labs which are checked are TSH, thyroid stimulating hormone, T3 and T4. Ben, would you like to expand on those? I suppose
Yes.
you order those a lot.
I order these a lot. Now, this can be a little bit complicated. So there is a range of the TSH, or the thyroid stimulating hormone. Now, we check that one first. And if it's too low or too high, we check the free T3 and the free T4, which are your actual thyroid hormones. Now, why do we check the TSH first? There's this feedback mechanism, and this can be a little confusing. If your thyroid hormones are too high, your TSH goes low. If these thyroid hormones are too low, the thyroid stimulating hormone goes too high. And that can give us, it's very sensitive and can give us right away an idea of what your thyroid function should be. Now, there are a lot of things that affect the thyroid function: medications, thyroid dysfunction itself, inflammatory conditions. So it's the kind of thing we need to check just to kind of know where you're at. And I'll tell you, if it's too low, you can feel very sluggish, tired, get a lot of swelling. If your thyroid is too high, you're making too much thyroid, you can really feel anxious, tremulous, kind of shaking, losing hair. It can affect you quite a bit. So it's an important thing that we check.
Absolutely. And to clarify, the TSH, thyroid stimulating hormone, it goes up when thyroid function is low, and it's low when thyroid function is high. So remember that little caveat there.
Yeah, it's kind of counterintuitive of what you'd
It
think.
is.
Exactly. So that's the thyroid stimulating hormone, TSH, commonly done. Okay, next up, we have two electrolytes that I'm a big fan of checking: magnesium and phosphorus levels. Many people are deficient in these. Peter, this is right up your alley.
It is. I think I give magnesium to everyone. I take magnesium myself. And so
Me too.
magnesium, I'm going to really focus on as a cardiologist, because you're right, Suneel, is that most people out there are magnesium deficient from a number of ways. Either you're not getting your diet, you're exercising regularly, and you're losing it through your sweat. You're on medications like diuretics, which can cause electrolyte abnormalities. A lot of these medications like omeprazole, or these kind of proton pump inhibitors that decrease acid in your stomach have just this quirky side effect of lowering your magnesium. And so why does that matter? So magnesium is involved in about 300 biochemical processes in the body. Obviously, if we don't have time to go through all of them, but the ones I'm going to focus on is really the heart. And so we know that low magnesium is really help stabilize the membrane of the heart and the electrical rhythm. And so that's so important in people who are having palpitations, which is awareness of your heart beating, or fluttering. So people who have premature beats from the top or bottom chamber, PACs or PBCs as we call them, magnesium really makes you hold on to electrolytes better. And actually it really can help suppress these extra heartbeats. So I always advise that to people who are having this awareness of the heart beating, that if everything checks out and they're having these, that just make sure that you're taking a magnesium supplement, but also for atrial fibrillation. So people who have atrial fibrillation, it can be triggered by electrolyte abnormalities. And I guarantee if you are low on magnesium, you're going to be low on potassium as well, because you just don't hold on to it as well. And so that's the main thing I would say that probably affects people the most in my world. Also, the other things is this cramping, muscle cramping, and people that complain of that. It's involved in just bone health as well, so which is more of your guys' field, and I'll defer it to you.
Oh, absolutely. I can be involved in bone health as well. And we also see it with conditions like restless legs, people that can't sleep. They complain of their legs twitching and muscle spasms. Magnesium often can help, not always, but often. And then you can see these, sometimes people take too much caffeine, things like that, and you can get some palpitations, or you're getting palpitations for other reasons. It's not hard to deplete your magnesium. And if you supplement, I've done this before where I've had some palpitations, took magnesium, got better. So, and I often see that in patients too, where you can supplement this and you see it makes a huge difference.
And that's a big also thing we should clarify too, is because people always ask me what type of magnesium to take. And I think there's lots of different loads of magnesium out there. The one I personally take that I advise my patients is magnesium glycinate.
Yeah.
And so I think magnesium glycinate is better absorbed. It's just better on the GI tract and gut. And so that's one I would recommend.
Yeah, some of the magnesiums can be very hard on the GI tract. Magnesium glycinate is known to be less so. I'm a fan. I supplement myself. Magnesium is interesting because often I find myself recommending supplementation. Phosphorus is a little bit more difficult. A lot of people who are low in phosphorus, I find, have other medical problems. There are lots of foods out there, vegetables, fruits, which are higher in phosphorus. That is a common electrolyte, which is deficient as well. Okay, those are 10 blood tests. We have a bonus blood test here, which I also recommend for men, which is testosterone levels, which are going down for various reasons across the Western world. So I would highly advise, if you're going to get some baseline labs of your metabolic health and you're a male. In fact, it's interesting. I find females also getting testosterone checked now as well, told various different things, but I would say more important, obviously, for males. Ben, are you finding in primary care you're getting requests more for people to check testosterone levels?
Absolutely. Yeah, much, much more. There are a number of conditions. Testosterone can be kind of the canary in the coal mine for men. If it's really getting low, it can kind of tell you that things are starting to go wrong in your body. And it does decrease with age to some degree. There are a number of medications that decrease it. People that are in chronic pain that have been on things like opioids and things like that, that'll radically decrease your testosterone. And what I find is often the right kind of people with supplementation see a dramatic response with their energy, their emotion. Testosterone is an incredibly important hormone in males, without question.
Exactly. And as you alluded to there, often there's another problem which is leading to low testosterone. I would say one of the main ones by far is this absolutely horrible pandemic of insulin resistance and generalized inflammation, because unfortunately, so many people out there have a very suboptimal lifestyle and are not moving. Excess body fat will dramatically lower any male's testosterone. They're not in shape. So those are blood tests then, which we highly recommend, some baseline blood tests. However you want to do it. Now, obviously, statistically, most people will go through the system. And if that's the right way for you, absolutely work with your doctor. But increasingly, I personally get messages from people who want to go outside of the system for whatever reason that is. I've told you, and I've been very transparent about my own personal thoughts on this. Despite having good insurance for many years, I don't like the idea of going through the system. I don't personally trust the system, and I'll be very open and honest, especially with chronic disease management. So I order my own lab test. But of course, I'm a doctor. So whatever you're comfortable with, remember, if you go online, and this is widely available, You can order your own lab tests. If you order these lab tests, understand that various different ones might be flagged if they're abnormal, and it's important to speak with your doctor. We would never encourage you starting any treatment yourself, or if you have something wrong, interpreting that yourself without that sort of medical supervision. That is important. But if you get the blood test and everything is looking good, then fair enough, because a lot of people I know and have talked to over the years do it themselves because, like me, they want to go through the system and just monitor everything themselves. Okay, everyone, thank you for watching. And do check in the links down below again for our separate unique channel and our natural health and well-being store, which is expanding all the time. Actually, also does include a magnesium supplement. Take care, everyone. Stay well, and we will see you in the next episode.